Well, look at this. Welcome. We are very happy to be here with you today. Today is our third interview, gubernatorial candidate interview in a series. And we are very thankful to have Amanda Renteria with us today. I want to take a couple minutes real quick just to thank everyone in the room. This is a really good looking crowd. Appreciate everyone's effort to get here. I'm Teresa Anderson. I'm with the ARC and UCP, and I'm representing the Lanterman Coalition today in the Lanterman Coalition interviews. Want to thank STEP for hosting us. This is amazing, wonderful room. Great crowd here, and thank Futures Explored for all their technical effort here in getting this interview going. So with that, I'm going to just go ahead and once again thank you for your time and generosity, and ask you to take a couple minutes to introduce yourself and give your background.
Sure. Well, I just want to say thank you, because it was great to go around and get a chance to say hi to everybody, and I know we had people who were early and on time. So thank you for making the time to be here today, and really for being involved in what I believe is just such an important thing for all of us, which is elections, which is who's going to govern our state. And I just think the more and more we can involve and have a discussion, the better we are when we can hear from everyone. So it really is a pleasure to be here. And I also want to thank STEP, not only for putting this on, but for all they do to really care for an important community. And I know you do that every day. When I'm not showing up or when other people are showing up, you're making it happen and really making sure that we're really helping all of our community. By way of background, I am originally from the Central Valley of California. I was born and raised in a little town, really in one of our lowest income districts in our state, Tulare County. My parents were former farm workers, and I really learned from them hard work. I became the first woman, the first Hispanic from my high school to go to Stanford. I went on to Harvard Business School. And then I've been in public service for 2 decades. Frankly, I fell in love with it as a public school teacher back in my hometown. And then I worked for the city of San Jose on community development programs and budget. And then I worked in the United States Senate for 9 years. I worked on everything from the fiscal crisis to the Affordable Care Act to the Farm Bill, to the auto reorganization. And at that point in 2013, I thought, what can I do with all of this policy experience? And I thought the best thing to do was to go back to where I grew up and try and make a difference. And so in 2014, I ran for Congress. And I remember being able to meet and see all the people that had grown up where I did. And I realized that the more policymakers can connect to what's really happening, the better our policymakers are, the better our political system is. After my campaign, Hillary Clinton called me and asked me to be her national political director. And so in 2016, I traveled to 30 different states, 2 territories, got to see our country from a whole new level. But I came to the same conclusion, which is the more we connect with each other, the better we will be. And I still believe in that today. For the last year, Attorney General Becerra, when he took over as the Attorney General, he asked me to be his Chief of Operations. For the last year, I've managed a 1,000-person organization and an $850 million budget. And we have really done everything we can at the Department of Justice here in California to uphold the values and laws in this state. And I tell you, it was a lot coming at us because we are in a new kind of environment with a new administration. But what I realized is, as much as we were fighting to uphold our values, I want to make sure that we're not just anti-administration or anti-something. I want to be pro-California, because I grew up in a state that truly believes in kids from wherever they grow up, even in small little rural towns in the Central Valley. And so much of what I've been doing on this gubernatorial campaign is making sure to connect with communities somewhat like mine who are often feeling left out in the Central Valley. I want to make sure I'm connecting with communities who might feel like they don't get enough of a voice in our political system. Because again, what I learned in 2014 is that we are better when we have everyone at the table, when we are listening to all voices, And so my campaign from the very beginning, I have said it from the very beginning, that we're running a different kind of campaign. And the entire notion is that we are better if we are one California. And that means that we are listening to all voices, all issues, wherever they are. And so as governor, I will continue to do that. I often say that, I used to play sports, and I used to talk about you practice like you play. In the same vein, when we're running for governor, you campaign like you're going to govern. And that's why I'm so excited to be here today, to really hear your questions and to be able to talk about the issues that are important to you. So thank you again for having me here.
Great, thank you. So the format, we're just going to run through a couple questions. I'll ask a couple and then make sure we get everyone in the room that has questions. And if you are watching online and you have questions, please put them in the chat box. So we'll start off, just kind of jump right in. I like what you said about we're all one, because I think that is a unified voice is really going to make a difference in the services that we provide. So what personal and professional experiences have you had with people with intellectual and developmental disabilities and their families?
Yeah. I have two nieces who were born, twins, who were born at 26 weeks gestation. And really throughout their entire lives, we didn't know what sort of developmental issues they would have as time has gone on. Now they are both just graduated from high school last year. And so not only throughout their lives have I seen the experience my sister and really our family has gone through to make sure that they can have the resources in school. Right? But now they just graduated. So for the last year, I've been up close and seeing what happens next, right? What are the paths to independent living? What are the paths to, they're both trying to make it in community college, but what are the resources there? And then really thinking about their lives going forward. It's real to me. And I've learned and really tried to help my sister, who is a single mom, try and navigate the system. And you begin to realize how important things like mass transit are, how important things like housing are, and how we're really bringing into the discussion of our policy making, wait a second, are we thinking about this as we're thinking about the Affordable Care Act? Are we thinking about this as we're writing our policies? So that's been my experience. And I think over time, what I've learned in the process is it's not easy. It's not easy, and it's pretty disjointed. And so I feel like the experience has been we've gone down a lot of roads, and then we hit a roadblock, right? And then you try and figure out how to get around it, and then you hit another roadblock. And so I'm well aware that for caregivers, this is really hard. And for folks who are in the disabilities community, they're hopeful, and you want to make sure that we're going to find a way. And that struggle is real.
And navigating those roadblocks are very real. The challenge is navigating that, and which is actually the perfect segue into the next question, which is people with intellectual and developmental disabilities today face ongoing fight for civil and human rights. And I think that you hit on that, making sure that there's compliance with the ADA, making sure that the Unruh Civil Rights Act, making sure that all those pieces of legislation that are so important, that are out there for protections, are upheld. How have you shown commitment to fighting for these rights?
Yeah, so a couple of things. When I was in the United States Senate, we had a lot of conversations, whether it was the Affordable Care Act, how do you make sure that voice is at the table, whether it's thinking through mass transit. One of the things that I have seen in policy makers is that there's one piece about making the policy, but making sure to link that to what's actually communicated on the ground, right? So it's not much different than when I say, my lesson learned when I ran in campaigning, which is I thought we had created all these great policies, and then you start knocking on doors and people say, yeah, that didn't work, right? Or they say, that does work, but I didn't know that was actually policy making process. And so I think what government, in a modern government, particularly now that we have modern tools where you can go online, where we have technology tools to be able to communicate with everyone, we have to make an effort that when policy is passed, that we're really thinking about implementation.
Right.
And I think that piece of it has been largely left out. where we think we put the policy together and it will happen. And so I think there's two things a way I have thought about it. One is we've got to start putting implementation plans into our policy, but then we need a feedback loop, right? And this is why it's important when people are campaigning to come here and listen to the exact things that are or aren't working. Some of us do have family, but not every politician does. And it's important that we're having not only people who understand the community, but that those that might not have a personal connection, that we're ensuring to make that connection for them of why something did or didn't work, or what is important, what kind of voice is important to have at the table. And so my goal is to make sure that I always have that kind of conversation at the table.
And this is a little off script, so.
Yeah.
But, I love what you said about the feedback loop, because I think that's a gaping hole, right? Mm-hmm. We don't have, how do you get to that point, and what does a feedback loop look like? And I'm not asking you for details, but I think that's the important piece here is you're right, when policies and procedures and implementation, that's all important, but then feeding that back and saying, how does that work? And if it doesn't work, what are some of the mechanisms to correct it? That's a really important piece.
Yep.
Because you can say, we have all these services, when in reality, we might be looking at them, but then saying, okay, now what? Maybe we don't have as many services in one area as the other. So I love that. I love that you're aware that there needs to be a feedback loop.
And let me one simple way that we should start to, and this is my vision of what a modern government looks like, what new leadership should look like as we think about our future. We should have stakeholder meetings, and not just stakeholder meetings through lobbyists that can get to you, but it's incumbent on political leaders to go to communities that can't always get to you. Mm-hmm. And that's a new way of doing things.
Right.
And this might have been hard maybe a decade ago, but today we now can do Facebook Live.
Right.
We now can have Skype conversations, right? I love that. I mean, when I was asked to come here and I saw that, I was like, perfect. Because I know it's not just about communicating with whomever could come today, although I really appreciate all of you coming today. I want to make sure we're also reaching folks who maybe can't make it here today. And there's no reason why political leaders shouldn't be doing more of this.
Right. I really appreciate that. I'm going to go ahead and turn it over for a couple questions. Debbie, would you like to ask your question?
However, people with developmental disabilities, most of whom have a very limited income, are often underrepresented in talks about solutions. What will you do about that?
Thank you. Thank you for the question. Number one, we've got to make sure that as we think about any housing policy, just as I was saying, that we're thinking about our communities with disabilities. And I know I've looked at some of the programs. So for instance, Utah has a program where they were able to house folks, but they wrapped it around with services. And so the most important thing as we think about whether it's homelessness or housing, that we're wrapping it around with the services that folks need. Oftentimes that's completely left out. And the ability to make sure that you have those services right near your shelters, that you have those services, whether it's vouchers so that you can get those services and make sure it's funded, that's the way we get there. And then overall in housing, we just have to increase our stock that we have, period. And in order to do that, we do need to pass a housing bond so that where there's more resources for housing in general. And then we need to do things like speeding up zoning and speeding up permits, because I know right now there's a lot of folks who can't find a home. And we can't wait for a 2-year construction loan or a 2-year permitting process in order to do that. And then the last piece is I really would like to see redevelopment agencies back online. So we can, so you have somebody, everyone has somebody to go to in the region, and you're not having to travel to Sacramento, but you can actually go to the jurisdiction there, and we can talk about what is needed for all of our communities, including the disabled community. Because I think, it's hard if you have a centralized program that's far away. We know what communities will be left out. Right. But if you have a closer, more regional process, then it allows us to have a more in-depth conversation with what's really the obstacles in that local jurisdiction. And so my hope is that when we have those regional conversations, I want to make sure my redevelopment agency is really bringing stakeholder groups. Just as I said, stakeholder groups are important at the statewide level. As we implement housing or homelessness programs, we need to make sure that we have stakeholder groups as engaged and involved on the local level as well.
I think that's important because just as everyone in here is an individual and has individual needs, communities have individual
That's right.
needs. So I think that's a really good point. We're going to go now to Lydia. Sure, come on up.
Lydia.
Family members often play the role of primary caregiver for their child or sibling with a disability. What proposals do you have to better support families whose work and devotion makes it possible for their loved one to remain at home?
Thank you for the question. I think there's two things. One is we have to provide tax credit, tax proposals that will help to be able to fund dependent care. But two, we need to make this process faster and easier. The idea that seeing my sister go through what she is going through right now and trying to figure out for her daughter what programs should or shouldn't work, and you have to wait and there's a timeline, and then that, like I was saying before, you hit an obstacle and then you have to go around it. Mm-hmm. All of that is time. And the idea that we don't have a more coordinated system, we shouldn't be in that world anymore. We're a modern state with technology that can help us centralize a process. And we need to be able to go in and say, my sister should be able to, just as every caregiver should be able to go to a hub and figure out how and what are my different resources. And right now we don't even have that. We don't even have a centralized place where a caregiver who might have to do it in off hours, right? Because some of these offices are only open a certain amount of time. Right. So even for the caregiver to be able to provide the best services, those hours aren't even available. So I would like, one of my main proposals of a modern government is to make sure that we're actually beefing up our centralized systems where we can, so that people know where they can go, and where you can also have a feedback loop. Right? Because that is exactly where a lot of organizations do that. That is exactly where my sister could provide comments and say, hey, wait a second, this was a great centralized system, but it took way too long.
Right.
Right? And you'd have the data to be able to say, all right, we're having problems. Perhaps in some regions it's better than in other regions. And let's practice that best practice. So I think there's a lot that we can do, not only in making sure caregivers have the resources they need, whether that's in tax breaks or grants, but making sure that they have the resources they need, in addition to improving the process itself.
Which is really important and goes right to the next question, which I'm going to turn over to Lynn. It really does flow nicely into that concerns.
Service providers are dedicated to serving people with developmental disabilities, yet they must accept rigid state set rates. Currently, there's not a good way to adjust these rates to respond to increases in certain costs, like local minimum wage. Do you believe that rates should reflect all the costs of doing business, including things like local minimum rates?
I think they should, yes. So I think we need to have a discussion on how are we going to make sure the rates keep up with time, right? We know costs go up. We know the price of milk goes up. People use milk as the indicator. And how are we making sure that we're keeping up with those costs on services as well? This has been an issue that we need to talk more about. And I think it's probably true that local jurisdictions don't know enough about that. That's been my experience, is that the first process is educating people about the service costs that are ongoing, and yet the funding has stayed like this, right? The rates have stayed like this. Yes. So guess what happens when, that means just fewer services, right? That just less care. And it's harder to get when we need staff to fund some of these community centers. It's hard because you're not keeping up with the salaries and the rates that really you can afford.
And you actually just hit it on the head with that answer. You totally get what we're talking about, which is the perfect lead in for the next question. Okay. I swear, guys, we did not rehearse this. We did not rehearse this. This is real.
So I wanted to ask, how can the state inspire workers to select a career in providing direct support to people with developmental disabilities with the current rates of pay not aligned with the expertise required to effectively carry out the work?
Yeah. So I think this is what we were just talking
Right,
about, which is
workforce.
we've got to make sure that our rates are appropriate with the services. The other piece to it is finding ways to also ensure training is cheaper. If training is a cost prohibitor, let's figure out how to make training cheaper so that we can have caregivers who are trained, who know how to get the training, and it's not a barrier to entry. So, these are the kinds of discussions that I think are important to have, especially with stakeholder groups, where we can work with stakeholder groups to say, where is the training? Can we improve the costs of training? So, or I should say, make it less costly on the training side, in order to make sure that we have more folks engaged and involved in this sector. So, yeah.
So we have one more question from the audience in here. I'm sorry. Did I miss one?
I have the Facebook Live question.
Oh, okay. I was going to say
Facebook
we have
Live.
one more
Okay.
in the
Okay.
room, and then we're going to go to Facebook Live. So I appreciate that. Thank you. Sydney, would you please ask your question?
Sydney.
California's developmental services system was founded on the idea of having local regional centers work with service providers to meet local needs. What experiences have given you the best understanding of the importance of responsive and innovative, locally based ideas?
So some of it is not on the positive side. On the negative side, some of it is that some of these regional centers have closed down. And that's been tough, especially in underserved areas, right? So the Central Valley has a waiting list for services and needs in a way that we've got to make sure that our regional centers are up and running and that we're actually funding them at higher levels so that you can actually serve the population at hand. But in terms of innovative ideas, what I will say is when my nieces were younger and those early years where they were able to get early attention before school started, really right as soon as they got out of the hospital, it's made a life difference for them, because we weren't sure whether or not they would be able to move their hands, whether or not they would be able to walk. But the innovative programs that were available at the time, that some of that have now since closed down, they changed their lives. I mean, they were able to move things, right? At those early ages, if you're not able to intervene at that point of time, it changes your mobility for your future. And so I believe that the quicker we can get care, whether it's, when we know at those younger years where your brain is still forming, and I have a husband who's in brain science, that stuff, you can't go back and make up that time. And so, so I have seen those innovative products, and the more we can make sure that we are funding those and that people know about them. Because some of it is, I was lucky that I have a tenacious older sister and she has two other sisters that are pretty tenacious. We were going to try and find the program, but it shouldn't just be based on that, right? It should be much easier to find. And also, I think a lot of maybe policymakers they haven't had this experience of knowing that it changes the trajectory of somebody's life to be able to find the care that they need, and especially the more innovative and earlier you can get into the process, the better rewards and outcomes in the future.
Thank you. Oh, we do have time for a couple questions from our Facebook audience.
First, can you tell me about your view of DSPs and their role?
DSPs, can you?
Direct support professionals.
Yeah, so I haven't had a lot of experience with direct professionals in my own personal experience. But what I do know is, especially when you come from a place like in rural America where you can't get to services, it's imperative that people can come to your house, that can meet you where you are. And particularly as I've seen my nieces grow up, and as they've grown up, one of them can't drive. And my sister's always working. And so the ability to have service care providers who can actually help her navigate through the system is incredibly important. And then I have had conversations with disability advocates and how important the service providers are to their link to all the services that are out there. In fact, in one of the conversations I had, it was the only way they found out about services, is because they had a service provider who was knowledgeable about everything that is out there. And so they're the conduit to really the access you need to be able to, whether it's independent living or in the case that I was talking to, how to navigate the college system in order to graduate and someday go to law school.
How would you show them their job is indeed a professional job for the direct support staff?
I think it's highlighting what they do and showcasing how important the work that they do is. So I'll just say this. I mean, I talked earlier about that I'm running a different kind of campaign. We have talked and really raised stories that people don't often talk about. I would love to talk about the role and actually have a conversation with service providers, because I think, again, in today's modern economy and the ability to use technology now, we need to tell the stories of what service providers are doing, the link that they are building, the bridge that they are building. So I'd love to follow on and have that kind of conversation so people can really see, and not just people who are out there, but our political leaders who are voting on policies of what they're going to do, what they're going to fund and what they're going to not fund. It's much easier to understand people's roles if you can actually see it and it's tangible to you. So I think we need to start showcasing that. And we have a great film crew here who I know could do it.
Exactly. And I was going to say, there'll definitely be no shortage of interest in that conversation. You will find a lot of people already willing and able to engage in that in a very meaningful way.
Wonderful.
So we are at time, and it went fast. This went really fast because there's still a lot, I'm sure, that people would love to know about your thoughts and some of the answers to other questions. But sadly, we're out of time, and I really just want to thank you. Appreciate your time, your generosity of being here, and let's just give a big round of applause.
Thank you. Thank you for having me here.
Thank you so much. We'll
Thank
follow
you.
up on those
Thank
questions
you.
for
Yeah.
sure.
Thank you.